Hello and very welcome to this evening session on Manavutsav. And this week, as you know, that it's a closing week, and I think we are touching on the very essentials that we need to actually know about. We need to understand life beyond the pandemic. And to some extent, this session today is going to be, we think that it's going to be a very valuable session that we are going to refer back time and again in the future as well. So the session is called Adapting and Easing Back into Life and Work Post-Pandemic. And we have with us, joining us today, Dr. Arghya Sarkhel, who is the lead consultant psychiatrist and co-founder director of Living Mind. And he is an incredibly experienced consultant psychiatrist with over 25 years of experience in mental health services. So I would like to welcome Dr. Arghya Sarkhel to the studio today. A very warm welcome to you, Dr. Sarkhel. How are you today?
Yes, all right. And thank you so much to Indrani, yourself, and as well as the Manavutsav, and of course, De Montfort University. And I cannot emphasize enough how timely this particular program is. So yes, I'm absolutely honored and privileged to be here today, Indrani.
Thank you very much. Thank you very much. We are really honored to have you today. And I think that this is a kind of discussion we have got requests, and we didn't want to bring it towards the very beginning of Manavutsav due to the fact that, you know, we will all go back to work in September. And there is a kind of anxiety, and we've received these kind of requests from the audiences as well, that can we actually talk about it? You know, what's going wrong? Why? I mean, now that we have adapted to a different kind of situation, how difficult or easy is it going to be? And is it me thinking about it? Is it anxiety, or is it actually really working from home has become, or is the future of work, you know, as you mean? So these kind of questions we are getting time and again.
Yeah.
So I think my first question to you is that, you know, there are lots of articles as well. So people are reading articles at the moment.
Yes.
And the thing is that, of course, with Google, you can search everything, and, you know, you try to, although you don't have a background in that subject, you try to make sense of what's being written. Now, one of the articles, you know, I want to start with that we came across spoke about different personality types and how they may adapt to life differently after COVID-19. And do you think that this is a kind of a right thing to assume, or is it something?
Yeah, I mean, it's a very, very valid question. And I mean, the first thing I would say that, you know, in the world we are living in, we all are born with different personalities. It's in our gene. You know, some of us are a bit more extrovert, some of us are a bit more reserved, some of us are a bit more perfectionist, if you like. So we can see there are different traits in all of us. So any change that threatens our life, whether it's a COVID pandemic, whether it's a job-related stress, whether it's a life, family-related stress, any external stress that throws us a challenge, you know, we become a bit off-balanced mentally. So our personality traits tries to cope their best with different strategies. So say, for example, if someone is reserved, probably they would like to go back to their shell and trying their best to cope. Unlike someone who is a bit more extrovert, likes to mingle with others, they will like their social channels to chit chat, talk it through. It's not about right or wrong. They all have their individual ways. But what I think is possibly the myth, and I'm quite happy to bust that myth, is there is nothing specific about, or this personality particularly will find a problem with COVID-19. It's not the COVID-19 as such. It's about a significant change or stress that the pandemic brought us to our lives. I think that's the key issue. So whether it's a COVID or something else, really that's not the key. So I don't think it is a COVID-related specific personality they will find it problem. You know, and I don't want to even see that as a problem as such, because we all try our best to cope with the things. And of course, when our coping strategies, we find it a bit more difficult, we can't manage, then yes, we might seek help. So I hope that I have clarified some of the sort of confusions that came about following that article.
Yes, I think, yeah, I think that that's absolutely says the message, because lots of people actually ask whether there are some barriers, and that barrier is actually created by their personality type, and it kind of creates more confusion. So I think
Yeah.
what you say absolutely makes sense, and I think that it's more about how we are trying to negotiate
Yeah.
with new normal in some ways,
Absolutely.
and that's possibly is the thing that you are saying here.
True.
So because last year I know that we did a session with you last year as
Yeah.
well, and that session was very much when we were encountering this new situation, the pandemic. We were starting, and the question was, how do we survive inside our houses, coexist, and all of that. And from that point to today, what do you think have been the main challenges of lockdown? What kind of anxiety, or what has been the challenges?
Yes, and I think perhaps just before I answer that question directly, it's worth looking at some of the statistics by, particularly the England, the Office of National Statistics. And the recent survey clearly showed that around pandemic or immediately after pandemic, at least 1 in 5 or 1 in 4 people who showed some kinds of depression or anxiety. I know it's quite vague. It's not a diagnostic measure as such. And very similar figures came out from US research as well about the COVID. And there's another big survey done by the Mind charity. They also have shown a significant impairment of mental well-being, and particularly for the young population, young generation, but across the board as well. Over 50% showed some kind of difficulties in their emotional. So, just wanted to sort of state to the viewers and listeners the scale of the problem. We cannot shy away from it.
Hmm.
So the challenges, I'd like to think in different dimensions. So one, obviously, we cannot, although it's a mental health related session, but it's very important. We cannot deny the physical health aspect of it. You know, some of us are a bit more vulnerable than others. For example, someone who's got already existing chest condition who are probably more affected. We hear that long COVID more and more. So physical health has been challenging for many of us. And of course, because of its unpredictable nature, we still didn't know how the disease is going to unfold. It has brought a lot of fear about uncertainty. And I think for me, that's probably the key focus and key uh, sort of trigger for anxiety. So the challenges are both at psychological level and social level, in addition to the physical side that we talked about. The social isolation, people are furloughed, so the economic challenges, financial aspect. So I like to think about physical aspect and the psychosocial aspect, then it's easier to think about the challenges. But as I said, that main thing is really being aware of it and think about, mainly, as I said, the social isolation one is particularly extremely challenging for most of us. Although I know some of us who have a slightly reserved personality, they probably quite liked it. The fact that you don't have to go out and mix with others, and I'm sure you will come on to those topics in later on in today's program. But yes, challenges are sort of multifaceted, really, at a multi-dimension. So
Yeah, and what do those challenges that you have seen say about the world that we are going to see, or the challenges? Because there are lots of news stories again out there which says that we are going to that we are expecting a tsunami of mental health issues post COVID-19. And so what does those challenges mean? And
yes, I mean, we are already, I don't know, how to define the tsunami as such, but definitely there has been a significant increase in the psychiatric consultations to begin with. When I have spoken to many of my psychology colleagues, the counselors, they have been seeing uh, more and more number of their clients or patients. So definitely the burden of mental health for the whole country has increased significantly. And And as I said, that it is although a mental health, but it will have a spillover effect on the society as a whole. For example, someone might have anxiety about going out, but it's not just about him or herself thinking about the family. In case what happens if I contract the virus, will there be fair on my elderly relative, say for example? So you can immediately see that it's not about individual, but then it spills over to family, friends, so on and so forth. So yes, so it is quite lots of factors, but that's why I wanted to make it a simplifying, that thinking more psychological level, at social level, the practical things like financial things. People are worried in case they will get made redundant. So we cannot deny those practical challenges apart from the mental health sides of it.
Yeah, and I think that that's something that possibly we will have to live with
Yeah.
for a foreseeable future, and we just don't know, isn't it? It's more about accepting. So, I mean, okay, so another thing that has quite often come up during this time is regarding, the digital meetings, and of course, professionally, we are more tuned to digital meetings nowadays.
Yeah.
Now you have started receiving, some of us have started receiving that you have to come back now and then let's practice meeting in person and all of that. So this digital meeting to meetings in physical spaces, does the transition impact the social anxiety to some extent? Because, we have seen that. And
Yeah, because what is really the fact that is, it might be the real world today, but it wasn't a real world before this COVID pandemic. Most of the meetings were expected to go, we'll have a chat, we'll physically meet each other, we'll greet each other. So that physical space is lost. It wasn't there. So obviously, I'm not saying the meeting wouldn't be as productive, but definitely that whole norm about a meeting in a physical space, that was completely over the last 18 months or so, that's no longer a norm anymore. So people are becoming sort of more, they're more habituated in terms of participating in those, whether it's a Zoom or all sorts of other social platforms, other on digital platforms. Um, and meeting is not just about discussing, but there's a social aspect to it, there's a psychological aspect to it. So suddenly communicating that in a digital space can be quite challenging because we haven't really learned that as such. When we first start attending the meeting, we then teach our trainees as well. And suddenly here you are in a digital platform. So we are all learning in our own ways. Some of us are a bit fast learner than others. So yeah, it has thrown challenges. That's number one. But number two is, often we know that, especially living in the same room or same house, maybe all the family members, the spouses, we are kind of both of are working perhaps. We only have got two rooms, and the confidentiality could be an issue. So all sorts of things can become a source of chronic stress, which sometimes I think is difficult for the employers to foresee, because they'll just expect an equally good performance or equally good outcome from a meeting, as if we are meeting physically. But it's very important to think about the social milieu is completely different when we are on a digital world. There'll be a phone call coming, Amazon might be knocking on the door, and we have to go and open the front door. And of course, it's an interruption for the meeting. So I suppose, as you said, being flexible, accepting those challenges, I think that will quite a helpful way of getting the best out of the employees. So,
yeah,
so yeah,
and then when we just got used to that digital space, say for example, from last 1 year, we have been learning quite a lot to use this digital
yes.
platform. That now suddenly we know that we have to now go and interact in a physical space, or we have to leave the house, and so that has drawn in some of the challenges as well. So what are the ways that we can adjust in a social environment, so
I,
that may
yes.
impact.
So I'd always say that one is, both from the employer perspective and the employee's perspective, being realistic in terms of what goal we are to achieve and in what time frame. I think that's absolutely vital. Because if I have not worked for 18 months in a physical environment, it is very difficult in all these back to back meetings, suddenly expected to go to the physical meetings 5 days a week or 3 days a week can be quite nerve wracking. So I think that it has to be a slow build up. That's an absolute sort of, it's almost like a rule of thumb, if you like.
Hmm.
Um, and if any individual is facing any difficulties, should have that allowance to talk to that person or to that employer at an individual level rather than having a blanket rule. Yes, of course, we need to adhere to the policies and procedures, but it's very important to look at that individual, why he or she is struggling. What can we do to facilitate? And maybe there's one more thing. I know there's a lot of emphasis about the employer, but I think it's equally important as an employee or as a student at the receiver end, we also need to take some responsibility. I think it's absolutely vital, if any problem you're noticing, to flag it up in the beginning rather than trying to bottle it up and saying that at the end before a full blown nervous breakdown takes place. So I think both employee, employer, receiving end, um, everyone is to take the responsibility and do their best to facilitate. So, to summarize, really, the slow build up, if an individual problem, flag it up at an early stage, and it's a bit more solution driven approach rather than the problem driven approach. I think that will be quite useful to make everyone a bit more relaxed and perhaps address their fear or anxiety.
This is absolutely crucial, isn't it? Like what you're saying there is like, you might have a strategy in your organization.
Yeah,
However, given that we have gone through it, a different kind of situation, we need to adapt to that, and we need to be extra vigilant to how people are reacting, and to have that open conversation and provide that space.
yeah.
Is that, yeah, yeah.
That's right, because policies and procedures are written with good intentions to help everyone, but it's impossible to think about every eventualities.
Hmm.
No one could even think about this. It will happen. In
Yeah.
2019 or 2020. So having a bit of flexibility, adaptability will help both sides.
Yeah, yeah. And there are, since there is a lot of anxiety involved in all of these, I mean, return to work at the moment looks really a challenging kind of situation. So what are the ways that someone can pacify the anxiety, possibly that they're going through?
Yeah. So I think the first thing I would say, that acceptance. One of the things that you already mentioned before, that this fear is not going to go away immediately. It's going to be there for some time. So when we are facing some changes, this time is back to again so-called real world, our mind is invariably going to be anxious. Sometimes mood perhaps goes down a bit, but that's an understandable reaction of a mind. That's not necessarily mean that we are weak or we can't do better. And this is very crucial for the employer to understand as well, because sometimes having some mental health symptoms can be seen as someone's weakness, and that's a completely wrong assumption for anyone to make. So accepting that these are the normal reactions, so that would be a bit more reassuring, and similar stance to be provided by the employer side as well. So that was the first thing I would say. And building up that, going back to the physical environment, doing it slowly rather than suddenly flooding ourselves into a full-time hours into the physical environment.
Mm.
Um, and as I said before, sometimes we are not worried just about ourselves, but also our families, perhaps some vulnerable family members at home. So we are going there, using public transport, coming back, understandably will be anxious. So, and again, having that space in our workplace, being able to talk about it, being able to confide in, rather than building up that anxiety and suddenly getting panic attack or suddenly, depression getting worse. So having that flexibility, slowly building up the hours, and perhaps a hybrid system to begin with, maybe few days at work, at the physical space, and few days at home. And again, what I just mentioned before, that looking at an individual level, yes, we have got the rules to follow, but at the same time to acknowledge everyone has got their own problems, and we don't know. We have lost our near and dear ones. We probably couldn't even go to visit or even go to the funeral. So they're carrying all those difficult emotions inside. So suddenly having to then deal with another change is quite difficult, and just sometimes appreciating it, acknowledging it goes a long way.
Yeah,
So
and that's absolutely crucial, isn't it? Because what you said there is again something that we don't know whether people, who are going returning to work, the kind of situation that they have dealt with, to where they are standing at the moment, and how they can, adapt to again a new change. And are there any physical sort of reactions when there is this anxiety in someone?
yeah, I was just about to say it's a very good question, because anxiety is one of the particular mental health conditions where often we see that apart from worrying, which is a psychological symptom, we are often burdened with lots and lots of different physical symptoms like palpitation, breathing quite heavily, known as hyperventilation, sometimes pins and needles, feeling in our sort of, fingers or, the feet, sometimes tightness in our chest or in our muscles. So all those physical symptoms are, of course, one has to rule out any underlying physical cause. But once that's ruled out, is very important to get the appropriate help. Even to say that, look, it is due to anxiety is going to go down, whether someone need counseling, might need a psychiatric help with medication. So I'll be, if anyone experiences any anxiety symptoms, it is very important. I'll suggest, at least in the first instance, go and visit your GP, at least in UK, making sure that any physical health condition is ruled out,
Hmm.
and then GP will guide us through with the right help, whether it's a talking therapy or it's medication or maybe combination of both. But yes, you're absolutely right, Indrani, that anxiety does lead to a number of physical symptoms which we need to be aware of.
There are also, some myths around anxiety and how we can overcome that. And one of the main things that's been discussed time and again is that, some people will say we don't want to go to a psychiatrist because they medicalize the problem. So as soon as I go to a psychiatrist, I know that they're going to give me some tablets, and that means that has got a long term. So these are the kind of, again, on top of that anxiety, you've got this anxiety then that, okay, is this medicine going to again create some trouble? What are you going to say
Yeah.
about?
Yes, I mean, we are all sort of, trying our best to reduce the stigma that you were just mentioning. What I would say that everyone to accept that how we address our physical health problems, please accept mental health problems in the same vein. Because, for example, if someone has got a diabetes, maybe in the beginning, not necessarily just going to be put on a medication, might be some diet advice, might for high cholesterol. So, similarly, not to assume that, oh, you go to the psychiatrist and definitely the psychiatrist is going to give you a pill. But if a medication is needed, it is needed, and that's advised by the professional. And same thing is true for physical health. So the idea is that, oh, if someone gets a counseling, he or she may not need medication, or vice versa. None of them is true. So it is absolutely vital to get it diagnosed properly by a specialist. And specialist, after the diagnosis, they prepare a care plan. And the care plan may or may not include medication. I do emphasize that it may not include medication. Not necessarily every time I see a patient, I'm going to prescribe a medication. That's not true at all. But at the same time, if someone needs it, we'll explain why it is, we'll explain the side effects, we'll explain the beneficial effects, and sometimes it's in combination with talking therapy. So I think it is absolutely a myth, as you said, that we have this stigma, we're medicalizing. It is not about medicalizing, we're actually identifying what's the problem. If you've got a high sugar, we give a diagnosis of diabetes, we don't say we're medicalizing it, a high sugar problem. So exactly same thing goes true for mental health. There are chemical abnormalities in the brain. It's not something we're making it up. We're experiencing this low mood, anxiety, and there are underlying chemical imbalances. So sometimes it needs help with the medication. Sometimes it's talking therapy. Sometimes it needs combination of both these approaches.
And I think that's again something very important that we are talking about here is possibly around the mental health literacy as well, isn't it?
Yep.
So, like we use the digital platforms, we all think that we are we know everything about the digital platforms. However, there are kind of patterns of behavior that we are adapting to, and all of that that's causing
Sure.
anxiety again. So, digital literacy, like we talk about, I think possibly mental health literacy is something that wasn't too much talked about before, but I think with the pandemic the discussion is now on the surface,
Yeah.
as like, yeah. And possibly we need to do more sessions. So what kind of, to enhance mental health literacy so that people understand and identify what you are saying there is that, we don't think about a physical, when we have got experience a physical problem. We just go to the GP, and sometimes if they don't prescribe you medicine, you just say, "Can I have that? Can I have that?" And they will say, "Oh, no, 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 you don't need that. Just have some paracetamol. That's fine." Whereas when you're going to a psychiatrist, we are just thinking on the other side of it, isn't it? So
Absolutely.
what are the kind of mental health literacy, so what are the kind of discussions need to happen, you think, around this so that people can
So when
understand?
I just go back to these return to work meetings that we were talking about, I think that one thing we touched on is obviously how to help everyone facilitating slow return to work. And what I say good return to work is not about return to work, but it's a good and effective return to work. So it's not about helping them now, but also in the longer term, we have to think beyond this COVID. We have to think about what are the things we could put in place, perhaps to minimize the risk of relapse, to identify if there are any vulnerabilities. If someone is a bit more higher risk, maybe they need a bit more support, mentoring. Maybe if they, are difficulty, maybe their work-life balance has to be looked into it differently. So I think that we have to look into not just the short term, but also the longer term. So prevention is one of the key things that we are not very good at talking about. We always talk about waiting for the problems and then, how to, but perhaps if we could have some strategies in place. And that is why I think the social intervention is very important. Coming out of the social isolation, slowly getting back to some activities, developing some hobbies and interests. And what COVID really has shown us that it's so important to have a much better work-life balance that than most of us probably we have. We need to think about our own interest as well, and that's not being selfish. It's about nurturing,
Hmm.
nourishing our mental health, because working tirelessly hours and hours, days and days, weeks after weeks, having no significant breaks in between, we are going to get brain fog. We are going to lose our concentration. So if an employer wants to get best out of the employee, my suggestion is we have to work together and see how best we can support each other. And again, I'm not taking the responsibility away from an employee as well. I think we both need to think about working together. It's everyone's responsibility. If our physical health is our responsibility, our mental health is also our responsibility. But we want employer to facilitate that. So definitely, I think that is a short-term approach, longer-term approach, and some kind of preventative approach. What are the things we can put in place? And again, that is where sometimes talking therapy can be invaluable. Really, the cognitive behavior therapy teaches us what are the strategies this individual particularly will benefit from if they put that in place. So rather than just waiting for the rainy day to come, we have got a toolkit in place. um, may I refer to, I've just looking into that Mind website has got a good toolkit about the return to work. So for the viewers and listeners, I think it's worth looking at it. Um, Simple tips. They have developed a toolkit after discussing with the psychiatrists, psychologists, and the ACAS. So it's quite a good website to have a look at. There are very various resources, but the key thing, as I said, accepting and having a very deviating from problem focus to more solution focused approach.
Yeah, and I think that what you're also suggesting there is that the transition is going to have an impact on the productivity of an individual,
Yeah.
and it's going to definitely have an impact on the work and the way people used to work and
Yeah.
will work in the future and all of that. So how does that, as an individual, if I ask you that, if I am going through an anxious state and I know that I have to return to work, and that I don't know whether I'm really anxious or because I got used to the home working kind of situation, what's happening? So how do we distinguish between that, and how do we know
Yes.
that there is a mental health
So,
concern?
if my anxiety is around, you know, basically it is stemming from the fear of uncertainty. We don't know what you're going to face. And then we catastrophize. We think about, if I do that, that will happen. And then what I'll do. And then you have a chain of catastrophic thinking. So it's important to have a bit of a self reflection. And particularly, I would advise everyone to practice some definite relaxation exercise in their own ways. Some of us like to listen to classical music, like to listen to some instrumental. Some of us are good at doing mindfulness exercise. Some of us are good at going to the gym or doing some physical exercise because that will give them some relaxation. So taking some active steps to do some relaxation exercise for our mind, uh, that will be very helpful. But secondly, accepting it that some of these symptoms are fairly normal reaction when we are facing this transition, and therefore expecting that I may not perform to my full potential, so that we don't get into this self-blame game.
Hmm.
And again, at the same time, for employer to acknowledge that, so that there's not a huge expectation right from the day one. So these are the little things that one can look into it.
Yeah, and so in that case, what should be a return to work conversation then look like? It's going to be focused around the individual, like you said, of course, that how someone is reacting or someone is working. Is that what you're?
Yes, and again, to be fair, from the employer's perspective, they need to give a reference to their policies and procedures because that's what they're for. But I
Hmm.
think they're only the guidelines, they're only a principles, and how an individual employee or a student would fit into that particular framework or the principles that were laid out. I think this is the discussion should look like. But the most important thing is to get that reassurance from the employer that this is not just about now, but also in the future, having an ongoing support. So some kind of flexibility to start with the hybrid mode, as we said,
Hmm.
in case that is proven difficult and maybe someone is having more challenges than one would expect, then guiding them to go to the GP perhaps and getting more professional help. So rather than thinking, oh, he or she is not capable of, rather than going down to the capability route necessarily in the beginning. So I think giving them a chance, facilitating, accepting some help, accessibility, I think that's another key thing because we do know that often there's a long sort of waiting list. We hear about it. I do acknowledge that. That's, it's, but at the same time, that should not stop us asking for help. I think this is important. NHS does provide a fantastic service. They could go to the GP in the first instance, talk about it, and often sometimes they can direct them to the counseling at the primary care level. So may not have to come to a psychiatrist, and problem might be resolved at that stage. So thinking about, oh, I'll be referred to psychiatrist, that may not be the case, because a lot of the time these are slightly uh, sort of serious mental health problem, but not severe enough to see a psychiatrist. And maybe just counseling for a few sessions will alleviate the problems, and someone will learn the strategies from those sessions. And having that conversation with the employer on a regular basis, it is not about one-off meeting. I think this is important. That having some follow-up meetings to see what it looks like, maybe perhaps to delay slightly for that particular individual. Uh, but the other thing I want to also highlight that what gives us is not just about the money. It's actually the purpose. It's about a different social environment compared to the friends and family. It also helps boost our self-esteem. We can see in black and white what we are capable of. So again, I'll suggest that when we think about the anxiety, also think about the what are the positives about returning to work. Being able to talk to someone, getting a direct feedback in a physical space for someone, oh, you have done really well. Those sorts of things are quite difficult now. If we are working remotely, any problem, we can quickly go to someone's room and talk to them. And now we have to probably send an email and waiting for an email to come back. So there are lots of positives. So whenever we are scared or maybe you have this fear of uncertainty, I want us to also think about what are the positives, you know. And this is of course beyond just the financial side of things. It's about, as I said, doing communication, social communication in a workplace. You know, we know that we have got some lunch breaks. We talk to each other. Sometimes we go out after the work, for a meal together, and all those, that's sort of normal life. Pre-COVID, how you used to do things. So those are all the positives will slowly come back. So yeah, definitely, return to work is positive, but it has to be dealt in a very sensitive manner. An individual has to be looked at rather than just necessarily one size fits all, and having flexibility on both sides, really.
Yeah, yeah. No, that's great. And then when it comes to the person, say for example, what you're saying on the employer side, now if it comes to the person, is there are there any particular ways how they can reimagine the workplace or visualize or kind of w- to boost their confidence? Can they do that on their own as well? Like have that conversation with themselves to think about work?
Yes, sometimes, I mean, what I suggest that sometimes, we all have our, sort of close friends or close family members. Maybe conversation can begin with at that level.
Mm.
Sometimes, what it looked like, what it actually, and then we realize that some of the fears we have probably don't exist in real life, but we are just not imagining necessarily, but we are fearful. We are thinking about the worst case scenario, but realistically, chance of happening that is very, very slim.
Mm.
So apart from self-talk, we can also talk to our someone that we can confide in, whether it's a close friend or family member. Just talk it through. What are our fears? And maybe that will facilitate when eventually we'll have the conversation with our line manager or someone. It'll be much more relaxed manner. We don't have to hide anything. And I'm hoping that line manager will be quite open about it. And the key phrase is non-judgmental about it. I think that's the key thing. Often with mental health, people think we are labeled, they're weak, they're inefficient. That's completely, unscientific. Because we wouldn't see that if someone has got a fracture or someone has got high cholesterol, we wouldn't see they're weak. So sorry, I'm keep bringing the analogy of physical health, but I'm just really highlighting how important it is to accept the mental health problem as one would accept a physical health problem. And if both employer and employee would understand that, I think that will solve a lot of problems to begin with.
Yeah, yeah. And I think that there are, of course, I mean, because your physical health is linked to your mental health, and as you said before as well, that we can feel it physically as well if you're mentally down or you're going through highs and lows and all of that.
Absolutely.
And sometimes people have also told during this time that they have gone through a daily ups and downs and weekly ups and downs or monthly ups and downs. And are there any tips to some quick tips how people can bring their moods back or how they can revive and all of that?
Yes, I mean, I would say that three A's. So the first A we talked about is acceptance, that no matter what we do, it is okay to have mood slumps, you know, in maybe once every few days or once every few weeks. So acceptance is a key thing. The second thing I would say that to find ourselves engaging into some kind of activity which is not really work related, something that we will enjoy, something we'll get joy out of it. We'll really cherish those activities. It'll sort of provide us with good memories for the future. So some kind of activities that we are interested in. So that's the second A. And the third A is that whatever little things we have in our life, trying to appreciate. So, and that's a great source of positivity. I've always talked about practicing gratitude is absolutely vital. It's very easy to get bogged down with the COVID statistics and things like that. But I think is we then forget about lots of good things around us, within us, the resilience. So appreciating three things. So just to summarize, acceptance, activity, and appreciation. So those will be my three sort of tips, really.
Yeah, and when you're saying that, I was, this is kind of a thing again. Someone said that they have been finding it very difficult to go out of the house, although they were kind of a sports person, and they, of course, not in like as a workplace sports, but they used to go to the gym and they used to go for long runs, but they don't get that push anymore of going out and doing it. And so in case of those kind of scenarios where people used to do certain things but they have stopped it because of this 1 year, where they are anxious that if they go somewhere and they contract it, then they don't know what's going to happen,
Yeah.
and that's what has stopped many people to go to a park, to a public place, and that anxiety remains, particularly when in the context of South Asian
Yes,
community.
absolutely. So, and my suggestion would be that if we can try and get engaged into that kind of activities, but perhaps at home to begin with. So the brain is familiar with these activities that someone has been engaged in for the last 18 months. So once the brain gets very familiar, then the next bit is slowly getting out. But gym might be too far to begin with, but maybe a gentle walk around our house, just a local park and come back. If needed, maybe to be with someone in case someone has got a panic attack or something, quickly has to come back. So, but to begin with, that's why I'm stressing about the activity is absolutely vital. We call it activity scheduling, some kind of schedule of activities throughout the day, I think is important. Doesn't have to be a big piece of work, but even that means going out for a park for 15, 20 minutes, coming back with a friend, and once we're more comfortable, then slowly maybe on our own, developing that confidence. So having a plan to get to the gym may not be from day one, but maybe it can happen in 2 months' time. But we can start that from our home environment where we feel a bit more comfortable. And that's what often we do sort of discuss that in the cognitive behavior therapy sessions. And what I've just mentioned, that is what we know as very gradual exposure to the environment that we get anxious about. I mean, the key thing I always say as a mantra is avoiding if we can.
Hmm.
Because otherwise, we are having a very false security. These things will make me anxious. So, okay, I'll not go to the supermarket at all. I'll do everything from online. So, what we're doing there, we're avoiding the things that would trigger our anxiety. But actually, if we slowly force ourselves to face those triggers in a controlled environment to begin with, we will be able to overcome that anxiety.
And that anxiety, do you think that can sometimes lead to depression as well?
Yeah, anxiety and depression not uncommonly go hand in hand. So it can be vice versa as well. Depression can also lead to anxiety, but if the anxiety becomes quite chronic, quite severe, untreated, then what happens? People start losing their confidence. That affects their mood. Of course, then we are into that vicious cycle, not meeting anyone, so there is no stimulation, and that maintains our low mood. The key is, I would say, that if we are feeling low and we are feeling low persistently, no matter what, we are losing the interest in the activities we used to enjoy before, losing our appetite, our sleep is difficult. I would say, please go and talk to your GP in the first instance. It may be that you need counseling or CBT to begin with, but it is quite possible that you might need some help from psychiatrist or from the GP from antidepressants, for example. And believe me, anxiety and depression, they are treatable conditions. So this is again some reassurance for everyone. Just like an infection can be treated by an antibiotic, yes, depression might take longer to treat, but it's a treatable condition. So rather than being fearful about things, what's going to happen, doctor is going to prescribe me medication, will I get dependent on it, is important go and get it sort of diagnosed that what's the problem, identifying what's the problem. Because sometimes we might have low mood, but underlying condition might be anxiety, as you said. So we have to treat this, and that is why I think the specialist help can be quite beneficial in certain cases. So
Yeah.
yeah,
So for the so say for example, when someone is feeling low and that's going for over a month, is that where they need to start looking for help, or at what point they should know that they need to
uh, I
help?
think yes. I mean, obviously, any persistent low mood over 2 to 3 weeks time, along with maybe loss of interest in the things, as I said, some physical symptoms like losing weight, not eating well, not drinking well, poor motivation, sometimes quite dark thoughts. Definitely to go and ask for help from the GP is absolutely vital, because help is available and this is a treatable condition. So yeah, definitely.
Yeah, and then we have also, we have got this experience. Of course, we have started here locally, kind of befriending people, giving some calls and all of
Yeah.
that, trying to treat within the community and provide that extra support and that kind of thing. But what we have also seen is that, people losing their very close ones, and that has had a very much negative impact on someone's mental health,
Yeah.
and they, of course, there are questions of self-harm,
Yeah.
where people have talked about that. People have talked about that they are not finding any purpose to life and all of that. So in those kind of situations where people are directly having this, say for example, this loss in their life that they have dealt with during the COVID time,
Yeah.
how can they, say for example, find this purpose to life? Like, what would that look like? Is it is it a kind of thought that is anxiety related or depression related, or something that they need to actually have a understanding about or absorb?
Yes. So I think what we are talking about here really the grief reaction or the bereavement. Particularly during COVID time, it has become more challenging because a we may not be able to, you probably not able to see the person before the death. Sometimes not able to attend to the funeral, or sometimes attending funeral through Zoom, which is nowhere near person actually would be there physically. Uh, Feeling a bit helpless. So these emotions about low mood, poor motivation, anxiety, sometimes obviously missing the deceased person, they are very normal grief reaction. They are not necessarily a depressive disorder as such. And we do know that the first 6 to 7 months we go through those normal grief symptoms. But I do think in the COVID it has become particularly more challenging. So sometimes the normal grief reaction might even extend up to a year or so. But of course, as you rightly pointed out, if the depression becomes quite severe, bit more disproportionate to just missing someone, thoughts of self-harm and things, I would definitely say to go to the GP in the first instance, because it is quite possible that with the grief reaction, sometimes there's a term we use called pathological grief reaction or pathological bereavement, where symptoms are excessive or disproportional to the what we normally expect from a grief reaction. And that might be due to underlying depressive disorder or underlying depression that will need treatment on its own right. So things that you talked about, quite severe low mood, thoughts of self-harm, definitely I would suggest go to the GP, ask for help. And in case it is out of hours, in NHS in UK, we have got crisis team or home treatment team available 24/7. They do have around the clock service. Even though you may not have any other contact with the mental health service before, please pick up the phone. Most of the time, information is available, telephone number through the internet, and to the local mental health crisis team or home treatment team, please ring them up and they'll be happy to help.
That's fantastic. That's a very good one. I think information
Yeah.
to know about as well. Um, just coming back to the medicine part of it, and where you was talking about, if you're getting depressed and if you need some more help from the GP, then you might be referred to a psychiatrist. And of course, if you might also need some medication. Now, some of the common myths around this medication is also like if somebody is taking the medication, they're going to be forgetful,
Yeah.
and that's going to interrupt with their daily, or if they come out of that medicine, then they can be forgetful, or they can have a, like memory loss kind of a thing. How do we,
Yeah.
again,
So yes, very, very good question. And often, I mean, I hear that in my, clinical practice all the time, these fears. So to have this very open discussion, first of all, no antidepressants or even any other psychiatric medications actually lead to loss of memory as such. That is a complete myth. So that does not happen. But what does happen is sometimes some of these medications can have some side effects. For example, excessive sedation or increase in sleep, feeling a bit drowsy. So of course, then we think, oh, we are not registering the information properly, and therefore we have got memory problems. But actually, it's not a memory problems, perhaps having the side effects. So we need to have a discussion with the psychiatrist at that point, or with the GP, whoever prescribed the medication, to see whether the benefits are outweighing the side effects. If the side effects are excessive, someone cannot tolerate it, then of course we are more than happy to look into the alternative medication rather than thinking that, oh, it will spoil my memory and therefore I'm going to stop it. That's number one. The other thing that you talked about, obviously, when you're going to come out of it, first of all, no antidepressant is addictive. I think this is first thing is very important for everyone to understand. There is no antidepressant that is addictive. And the only thing which can be addictive, which are like diazepam drugs, if we take it for a long time, it can become addictive. But antidepressants are not addictive. So, yes, when we do come out of it, some of the medications can have some withdrawal symptoms, but most of the time, without any interference, just from if we wait for 10, 14 days, most of the symptoms subside. And it does not cause any long lasting damage to our any other organ like lungs, liver, kidneys, or anything. So, but again, most of the antidepressants do not cause withdrawal symptoms. One or two does, and that is why it's important to be supervised by a psychiatrist or a GP, coming off slowly rather than stopping it completely. And if you do that, then a risk of experiencing those withdrawal symptoms will be very minimum.
that's fantastic to know. Thank you very much. No, that's really good. And the other thing, just as we are coming towards the end of the
Sure.
session, people have been also asking that if you are, so we are returning to work,
Yeah.
and then what happens if the COVID numbers go up again and we go into the lockdown situation again? Again, how do we prepare ourselves for the uncertainty? I think it goes back to your very basic discussion that you started with, saying that dealing with uncertainty is the problem during the COVID time. So, what would be your suggestion or advice to people on that point?
I think that hopefully after these 18 months or nearly 2 years, um, we had been in this situation before, so it is not the first time. So one way it might be positive that we are in a better place now because we were already prepared to a degree, and then we became more and more familiar with this COVID-19. What are the challenges, and masks and all those. But I would say that trying to concentrate on the present, of course, is important to do a bit of a planning. We wouldn't know, the government wouldn't know up and until the cases go up, and of course then the appropriate authorities will take appropriate actions and policies and will adhere to that. Now, so it's impossible to think about every single scenario, and because it's impossible to think about that, it is, if we do think, is only going to increase our worries or anxieties, is not going to necessarily lead us to any solution. So simple basic things that, as we learned, in terms of the social isolation or masks, and those will, it will be governed by whatever the policies and procedures set by the government at that time. But key thing I would say, going back to the mindfulness approach, looking at the present, making most of it now with, of course, appropriate precautions. And really, my suggestion is we do need to look after our mental health actively. So, uh, fear of uncertainty, to a degree, it will always last with all of us. We can't deny it. So, accepting it, but at the same time, if we can engage into those activities, what we are supposed to do at present, and appreciating. So, what I'm trying to say, going back to my three A's, really,
Yes.
that will be my sort of suggestions, or you know.
Yeah, and they were the ones. If you remind us again.
So the first one is acceptance about the fear of uncertainty. Cases might go up or not, we don't know. Two is activity, engaging into regular activity. And three, appreciating even simple, small things in our lives and within ourselves.
That's absolutely fantastic. It's really been a very eye-opening session. We have been able to kind of address many of the questions that we have been asked, and we were looking forward to this conversation, as I said, for a long time. And I think that as we go in the future, possibly we will all be able to direct people to look into the recording, but also just for the audience, that if you want to book an appointment and if you want to get in touch with Dr. Sarkhel, we have got the number here that we have been scrolling down. And then if you want to also write an email or have an appointment, you can still get in touch. So either through phone or through emails are the best ways to get in touch. And we have been also receiving some comments, which I would like to play here. And so great to hear from Sangeet Foundation. And then we have got, okay, so that's more about the hosting thing. And then we have got, again, the discussion and stuff. So I think that we are all looking forward to it, and we will be referring it back to it time and again. Thank you very much for your time. And I know it's a Sunday evening, but apart from your all busy schedule, you have managed some time and given it to us. We are really thankful for your time.
Thank you very much, Indrani. Really appreciate fantastic effort, by Manavutsav and also the Sangeet Foundation. Really, very timely event, and I hope that the viewers and listeners have found it helpful. It will be also in the YouTube, I think, so people can tune into it later on if they want to.
Absolutely, yes. And thank you to all of our audience who have joined us today as well. So on that note, thank you very much again. We are going to end our broadcast here now. Yeah. Thank you.
Thank you.
Thanks.
Thanks. Bye-bye.
Bye.